And I know it feels like we've been waiting forever for a COVID vaccine, but imagine having to wait 4 years for one. That's how long it took to develop the mumps vaccine. And before COVID, that was the quickest one to ever be developed. So really, we're kind of lucky, but researchers may have had a leg up on this virus. Take a listen.
We were first alerted to the coronavirus in December of 2019 when a cluster of cases popped up in Wuhan, China. The first U.S. case was reported a month later in Washington state on January 20th. So when did work on a vaccine begin? Let's connect the dots. The World Health Organization didn't characterize COVID-19 as a pandemic until March, and work on a vaccine began shortly after. Fast forward 9 months, Pfizer announces its vaccine is 90% effective and could get to healthcare workers in December. A remarkable race for researchers, but scientists did have a slight advantage with this one. They were able to use past research on SARS and MERS vaccines to get started. Not to mention the entire science community across the globe came together to create a vaccine as soon as possible. Early predictions said it would take 12 to 18 months, and if Pfizer's and others in the pipeline stay on track, the COVID-19 vaccine will become the fastest created in history.